Hello, everyone. About 18 months ago, I lost my job here in Delaware. I'm currently a computer nerd. I'm a freelance computer nerd. Unfortunately, being a freelancer, you don't get any benefits. You're just paid hourly. So what I've been doing is using my former employer's health insurance, which is called COBRA. You can use the health insurance for up to 18 months, but that's running out at the end of September. And what I've been doing is going on to eHealth insurance. Fortunately, as you can see, let me zoom in just a little bit here. Had a fun little experience with Aetna, and as you can see, I was declined by a carrier on August 30th. It was an interesting situation. They are our current carrier through my last employer from 18 months ago, and I had to speak with them and felt like I was had a spotlight on me, like I was being interrogated at the police department. Just all these different questions. The worst part is they ask questions they know the answers to. They ask questions that are you plainly and clearly filled out on the application about doctor visits, things. So anyway, they must not have liked the answers because, as you can see, it's declined by carrier, August 30th. So we went ahead and applied with Delaware a few days later, and on September 3rd, it's September 13th, Friday the 13th, lucky day, and they still haven't responded. And I'm kind of getting the feeling, Aetna, excuse me, and Highmark are very similar companies, and we're probably going to get the cold shoulder from Highmark and be declined there as well. What's killing us is my wife has a high blood pressure, cholesterol. She takes Lipitor, and she's battling TMJ. For those of you that don't know what TMJ is, just she's having trouble chewing really like steaks and bagels and chewy things. She can eat most foods, but the TMJ, she eats something really difficult to chew, her jaw pops out of place. So Aetna didn't like the sound of that, and like I said, they declined us. So I'm guessing we're going to get the big old thumbs down from Highmark here, and I'm not sure really what to do. I know there's short-term health care I can get, which lasts up to 6 months, is cheap, but they don't cover any pre-existing, which means they won't help. It's almost useless unless you have a new illness that pops up. Excuse me. So if it made this video, I just want to get a suggestion from you. I'm thinking maybe go with the short-term care because Obamacare in 4 months, and that's a whole nother labyrinth of it's a maze. There's so much information out there. It's almost overwhelming. So I'm not quite sure what to do here. I'm not going to waste my time and apply for a third insurance, a third regular long-term insurance. It'll just be a waste of time if the first shoot us down. So I'm thinking short-term health care to get us through to January 1st and apply for Obamacare, which the one saving grace I see is you can't be declined. But I know so little about it in terms of pricing. Just because they can't decline it doesn't mean they knows for the service. So we're having a bit of a panic in the family right now. My daughter and I were actually accepted by Aetna, but we didn't want to do the separate insurance. One person has one card, another person has another card. So we're going to kind of sticking together as a family. I might go back to Aetna and apply for myself and my daughter. Like I said, we were approved and my wife was declined, so they declined the whole family. And you can reapply individually if you want. That's one of the things they let you do. So obviously Aetna and Aetna, they want you, perfect health, I suppose, with nothing wrong with you ever. We spoke with them. They were asking me about a gallbladder operation from 7 years ago, and you visited the doctor in June of 2012. Can you tell us about that? I don't know. I don't even remember. Anyway, I know a lot of you have been late years and you're doing the COBRA thing, which costs a fortune. It's great because you have all your coverage from work, but it costs a lot and it runs out. It's almost impossible to renew it unless you have a major disability that you can report to Social Security. Anyway, so bottom line is if anyone has a thought, I'm sure there are probably some high-risk insurance carriers out there and wash it through the nose, I'm sure. That might be our next step, or we might just go with the short term and pay for any blood pressure, cholesterol things. It's not bad. They just have my wife on these pills, which I don't really agree with because she's in good health overall. But Yeah, if you're on pills, if you can, if you're on those types of pills and you can take a natural, holistic approach and eat better and exercise and get off those pills, it's really going to help you down the line. Just whenever, if you have to go through the situation, it's really going to help you because you don't have to go through the pain of by carrier. So that's the plight of the COBRA recipient. I really like being a freelancer. I get to work from home and paid very well, but no benefits at all. Nothing. So we have to go out and buy it all. Anyway, leave a comment. That's why I made this video. Please leave a comment and let me know what you think. What's our next step? Thanks for watching, everyone, and take care.
If you live and work in Nigeria, then it's important to have a good health insurance plan. Although Nigeria has some good basic outpatient care, if there's a medical emergency, then it's highly likely that you're going to be evacuated, probably to Dubai or possibly to South Africa. There are lots of good international health insurance plans that can do this for you. A basic plan, would typically be inpatient and outpatient, maybe maternity, maybe dental, and there is always the option to add on the evacuation cover. It's important if you're living in Nigeria that you take this option. Many insurers can do this for you today. Companies such as Bupa or Allianz or Cigna or Aetna or AXA, all of them have this option. So it's important that you look into the details and find the right plan for you. Africa is an amazing continent and Nigeria can be a very exciting place to live. But make sure your health insurance plan, if you're living and working in Nigeria, is the right plan that's going to help you if you have an emergency. Please come and talk to us.